Access Minnesota. Issues that matter to you. Access Minnesota brings you the newsmakers and the stories that shape our everyday lives, with analysis from University of Minnesota faculty experts. Now, here's Jim Dubois.
The Affordable Care Act, also known as Obamacare, launched on October 1st. Controversial from the start, website issues and thousands of canceled health insurance policies threaten the very survival of the president's signature program. While President Obama and congressional Democrats scrambled to fix the website and encourage the uninsured to sign up, things have gone more smoothly here in Minnesota. This month on Access Minnesota, we look at our state's healthcare exchange program, MNsure. We'll learn how MNsure works and how our exchange compares with those in other states. We'll also talk with University of Minnesota political science professor Larry Jacobs about public opinion of the new law and potential political consequences for Democrats in the 2014 elections. But first, a conversation with April Todd-Malmlov, the executive director for MNsure. April Todd-Malmlov is the executive director of MNsure, which is the state's online health exchange service. April, welcome to Access Minnesota.
Thank you for having me.
Tell us more about MNsure and the services that it provides.
So what MNsure is really a simple one-stop shop for people to be able to find health insurance coverage. And it is for individuals, small businesses, that are either uninsured or have coverage today and are looking for different options, more affordable options. And it's also the place where people can get low cost and free coverage as well through our Minnesota Care programs and our medical assistance programs.
What is the difference between MNsure and the National Affordable Care Act?
Well, the Affordable Care Act that was passed in 2010 really is a large federal law. Under that law, each state needs to have an exchange in it. States could either operate that themselves, or they could have the federal government do that. MNsure is Minnesota's state-based exchange. So the exchanges are one component of the ACA, but it is a much larger law. So MNsure does a portion of the ACA, but not all of it. We're not doing every piece of it.
Minnesota is one of 16 states, along with the District of Columbia, that elected to set up their own state exchange program. The other states are relying on the federal government for that. Why did Minnesota elect to set up its own healthcare exchange?
I think there's a lot of reasons why we wanted to do our own. One is we've always been a national leader in healthcare, and we wanted to be able to maintain everything that we've done here and make it better. And so we wanted to make sure we had local control, that we could provide services that really were Minnesota specific, that people here want, and also that we could be as responsive as possible to Minnesota's needs. So we can react very quickly to what Minnesotans want, and they can call a number here in Minnesota instead of calling a 202 number to get help. So for us, it really was local control, local responsiveness, and making sure we're meeting the needs of our citizens.
How much flexibility does the federal government give to MNsure in terms of operating the site?
So there are some basic federal requirements that all state exchanges need to comply with, but there's also a lot of flexibility that we have in terms of how the state is run, what type of information that we put on that, the types of plans that are available. Minnesota, for example, has the lowest premiums in the country, so we had the flexibility to do that and to come up with those great rates. So there definitely are some basic requirements, but we have a lot of flexibility to run it our way.
Let's talk about the rates in Minnesota. We have heard that the rates are among some of the lowest in the country. What's the reason for that? Is that because there's been a history of health care in Minnesota that has been more affordable for its citizens?
I think there are a few different reasons for it. One of them is one that you mentioned. We have always been a very innovative state in terms of healthcare reform and doing what we can to bring down the cost of that. So I definitely think our providers and our insurers have done a good job in doing that. I think also because we did our own state-based exchange is also a reason. We are bringing a lot of transparency to the market. So people can actually see what the rates are, and it will drive competition and make people more conscious of price and quality, which will drive competition.
Tell us more about the launch of MNsure. We know that the federal government's launch of its website on October 1st has been rather botched to begin with, but have things run more smoothly here in Minnesota?
Things have absolutely run more smoothly here in Minnesota. We had a few bumps initially when we started. Many of those were related to us needing to use federal services. And one of them in particular is called remote identity proofing. And what it is that we do and all states need to do is we need to verify that people are who they say they are. And all states use a federal service to do that. And that federal service had some glitches during the first few days. And we worked through that, and after the first few days, we were up and running pretty strong.
What are some of the major complications that we've had to deal with in Minnesota so far?
You know, really, we haven't had a lot of huge complications. What we've been doing really is taking in feedback from consumers that are using the site, that come in from our call centers, emails that we get through social media, and based on that feedback, we are trying to adjust and modify the site as quickly as we can, so that we can increase the consumer experience as much as possible for people.
Are there any aspects of the federal law that are making it more challenging for you to roll out MNsure in Minnesota?
I think the ACA is just a challenge just in and of itself. When you think about how big this law is, it is the equivalent or greater than, in my perspective, starting Medicare or starting Medicaid, Social Security. It's a very large change and a large law. And doing that in a 2 to 3 year period is a lot of work to do in a short amount of time. So just that in and of itself it is a challenge, and I can't give more kudos to my staff and others that we've worked with in state government to get this up. Is just the hard work and long amount of hours that they've worked to get this up is nothing short of phenomenal.
When Access Minnesota returns, we'll learn more about the people who've signed up for health insurance during MNsure's first month in operation.
Access Minnesota will return after these messages.